Today I'm stopping to have a breathing break. So if you're available, I am live and I am so excited to bring you this short breathing session to teach you about three-part breath. This is such a really neat way to help you connect better with your respiratory diaphragm, strengthen the respiratory diaphragm, but also there's a lot of stress management benefits to breathing this way. So with a stronger respiratory diaphragm, you're going to be able to manage overwhelm, stress, all of the things that are keeping us more in that chronic, stressed out state. We're going to be able to manage that better when we strengthen the diaphragm, when we breathe in this way. So just taking a few minutes out of your day to be here with me is so beneficial to your health and well-being. So thank you for being with me. Today, you'll want to find a comfortable place to sit down. You can lay down completely. Some people like to practice their breath work that way. If you're doing this right before bed, it's fine to do it right before bed. It's fine to do it in the middle of the day. It's just going to help you manage some of that stress and work on the respiratory diaphragm. Now, please get clearance with your doctor. Please mind your body. Please be respectful and listen to your body. This is not intended to be any type of substitute for medical advice. It's just intended to help you support your health and well-being if you are able to use breath work and if you're cleared by a doctor. So with all of that, again, thank you for being here on my channel. My name is Erin Wilson. I'm a physiologist and breathing coach. I also coach in communications. So I have brought my two passions together, communications, mindfulness, and wellness, and I help people in both areas. I have a program called Speak Well, which is a 6-week public speaking program, as well as a program called Breathe Well, Live Well, which is a 60-day wellness and mindfulness program. So if you're interested in any one of those are private coaching programs that I offer. Just go ahead and connect with me on a live coaching call. First 30 minutes is just a free conversation for us to get to know each other to see if either one of my programs would benefit you. Let's begin today. Go ahead and find that comfortable place to sit down. You might want to use a pillow or some books if your back is bothering you and it's tight, if sitting like this bothers you. You also have that option to lay down flat on your back and sit that way for breathing. We'll be doing 3 rounds of breath today, and we're progressively going to strengthen the respiratory diaphragm more. So imagine it almost like that bell curve where we're going to take our time to warm it up, work a little bit harder on strengthening with isometric contractions, and then we'll lower down. Please do not be intimidated. If you are new to breathing, this is pretty suitable for any level, no matter where you're at, and you're always going to listen to your own body. You don't have to go exactly at my cue or at my pace, but I want you to be here today and explore your body. Start to explore your breath and some of the benefits of breathing in a suboptimal pattern. So today we're talking a lot about the respiratory diaphragm. This is a hard muscle to connect with because you can't see it, like your bicep. But here it is. It's going to be underneath the rib cage. It's in the center of the body, and it's the whole middle. So I think of it as like the mothership. It almost is shaped like a jellyfish in a way that it has this dome shape. And when you inhale, it should be flattening down. It should be contracting on the inhale, which creates kind of that belly breath. It creates kind of an outward lateral movement of the ribs. It opens up the body on the inhale if you're breathing correctly. What I sometimes see if somebody's really, really stressed, or maybe they're in their postpartum period, or if they sit a lot, or if they've had trauma, I see a lot of breathing where somebody's going to inhale and pull the diaphragm up higher into their rib cage. So this would be the exact opposite motion that I'm looking for. I don't want your inhale to allow that diaphragm to move up. I want the inhale to flatten the diaphragm down. So we want the diaphragm to contract on that inhale. I want you to start to imagine this, and that's what creates this intra-abdominal pressure. That's what creates this stretching sensation. You will definitely feel this in the 3-part breath. So we're working the respiratory diaphragm. We're also working the muscles in between our rib cage. These are our intercostal muscles. These muscles are also going to they're going to contract on that inhale, which will make it feel like your ribs and almost like your chest area is expanding out. Then we have our secondary breathing muscles. Again, if you're inhaling and you're sucking in like this, if you're really stressed, some of those things I mentioned earlier, you're going to be using more of your secondary breathing muscles, our neck and shoulders, for your primary breathing movement, which is not what you want. We want to use the respiratory diaphragm in connection with the intercostals and also a little bit of the neck and shoulders, but not as the primary mover. So I hope that explains a little bit more about the respiratory diaphragm and the muscles that I want you to use when you're doing these breathing practices. The more you use it, the stronger it will get. It is a muscle, and it's also a muscle in the sense of if you don't use it, you lose it. So we say that about muscles. You don't use it, you lose it. So you lose that. First, we have to build that neuromuscular connection, and then we start to build some of that strength. So keep coming back to this 3-part video or any one of my other videos about breathing. Keep coming back to it because over time, you'll start to see that you really do strengthen the respiratory diaphragm. Maybe you've just been in the habit of not using it as much. So that I just want you to give yourself some grace and give yourself some time in getting to have it a lot stronger. Now, it's really wonderful for stress management, but it's also really wonderful if you experience back pain, if you have trouble with your core and connecting to your core. So learning this 3-part breath and working on respiratory diaphragm strength is going to be good for that. It's also going to increase your lung capacity. These holds that we do that we'll build up into, that's going to increase your lung capacity, which some studies have shown us that that's the number one indicator for lifespan, somebody's lung capacity. So instead of breathing short and shallow like this all day, or holding the breath, or just not really getting these really nice full breaths that you're about to experience, without doing that throughout the day, you're decreasing your lung capacity. So starting to do things where we're breathing longer, we have some retention, we're breathing in a suboptimal form is going to be very beneficial to your health long term. Today, you'll feel that stress management release, but long term, you'll be extending your lifespan. So that's really cool. Enough of that. Thank you, everybody who's here. Let's go ahead and begin our practice. Get comfortable, lay down, sit down. Close your mouth, smile. Thank you for being here. Close your eyes if you like, and just listen to my voice. When we close our eyes, we release some of the distractions that we all have. And when we start to focus now on the breath, in and out of the nose, we start to observe the quality of our breath coming into today's practice. We start to get more grounded in the present moment, where we're not worried and thinking about the future, anxiety, where we're not sad and ruminating about the past, feeling depressed, when we're not in forward thinking or past thinking, but we're in present moment, we can connect more with peace, joy, love, all these things that are going to feed our soul and our spirit. So close your mouth and breathe through the nose. Body is soft. Notice the body in it. Can you release any tension that's not needed in this moment? Soften the body. Feel the weight of your body on the floor. This connects you to the present moment. Just involving your senses. Start to notice sounds that are not just my voice, but start to notice sounds in the room, or if you're outside, notice what you hear. Observe the quality of your breath as it comes in and out of the nose. This is a simple grounding technique I use before any breathing practice. We are softening the body, we're bringing the focus to the present moment. And if there's anything that is stressing you out that you walked in today with, or that's heavy on your mind, I want you to allow yourself to surrender that for just this time together, for just this moment that we're going to be together breathing. And you can pick it up if you want to when you leave. Just allow yourself to surrender some of the stress or anxiety that you might have with you today. Bring that smile back to your face. Notice what that does to your physiology, your body. It releases chemicals in the body. Should feel good. And then soften the face again. If you're new to this breathing practice, you might need to open your eyes and watch me a first few times. But if you can, it's best done with the eyes closed. And you can just listen to my voice. I'll be as descriptive as I can be. We'll be breathing in and out of the nose to start. When you inhale, I want you to feel the stretch from the base of the pelvic floor area. I want you to inhale, fill the air at the bottom of that area, and keep inhaling, fill the belly. That's the first part. Then you keep inhaling, you'll feel the chest and the ribs will expand. Then you keep inhaling and the collarbones rise. That's the 3 parts. And then you'll exhale nice and slowly. So let's try it together. Inhale, fill the bottom, the belly, the pelvic floor. Breathe into the chest, ribs expand out. Breathe in a little more, and then slowly exhale. Feel everything release and almost hug in towards the midline. Inhale, breathe in, the first part. Now breathe in the chest, the ribs expand. Keep breathing, you'll feel the collarbones rise. And then slowly exhale out of the nose. Take your time. Inhale, fill the bottom, pelvic floor, belly, stretch the low back. Breathe into the ribs, the chest. Keep inhaling, feel the collarbones rise. And then slowly exhale out of the nose. Release, feel that letting go sensation. Inhale, fill the pelvic floor, the belly. Keep inhaling, fill the ribs, feel that expansion, intercostals. Keep inhaling, and those secondary muscles get involved. Then slowly exhale, release. 3 more breaths, just like that. You're doing great. Inhale, fill from the bottom, fill the belly, fill the ribs, fill the chest. Keep inhaling, collarbones lift. And then slowly exhale, release it down. 2 more breaths like that. Inhale, fill from the bottom, the ribs, the chest. Keep inhaling, collarbones lift. Slowly take your time on the exhale, fully empty. So you want to actually feel a little bit of that contraction in the core. I want you to fully empty. So now we're starting to work that respiratory diaphragm, and hold gently at the bottom. Then again, inhale, expand last time. Pelvic floor, belly, ribs, chest. Take in a little more air, and then slowly exhale. Go to the very end of your breath. And then just hold there for a moment. Fully empty your air. Feel that isometric contraction on the eccentric phase of the diaphragm. Now relax. That was a 3-part breath. You should have felt the stretch and almost the stretching from the inside out on that inhale, and then that slow exhale release. So when we do that, we're working that respiratory diaphragm. The vagus nerve passes through our respiratory diaphragm, and that's going to help us tap into the parasympathetic nervous system state. This is good for vagal tone. We want to be able to activate that more calming, restorative nervous system state when we need to, especially if we're feeling a lot of stress and anxiety. So that's a benefit to working this respiratory diaphragm. Now that it's warm and you're ready, now that you know the suboptimal pattern, I'm going to cue you now to inhale the same way, but I'm going to have you hold that inhale, which means that we're having an isometric contraction in the respiratory diaphragm. So you hold the breath at the top just for a few seconds, about 4 seconds, and then we're going to exhale, hold the breath at the bottom, another isometric contraction with the respiratory diaphragm kind of being lifted up in the center there. So you might not be able to see this muscle, but I want you to kind of know what's going on. Inhale, it'll flatten out, and then we're going to hold. And then when we exhale, it draws up, and we're going to hold. Let's begin here. If your eyes aren't closed, go ahead and try to close them for this round. Close your mouth. Start to breathe through the nose. Settle any tension in the body. Notice if you're holding any tension, let it go. Let's begin. Inhale from the pelvic floor, the belly, the low back stretch. Keep inhaling, the ribs expand, the chest expands. Keep inhaling, collarbones lift. Hold the breath at the top. 2, 3, 4. Exhale, slowly lower. Release the air, go to the bottom, empty out. Feel a little bit of a contraction in the core there and hold. 1, 2, 3, 4. Inhale, fill from the bottom. Middle section. Little higher. Hold. 1, 2, 3, 4. Exhale, release. Fully exhale. You want to squeeze that breath out. We're strengthening the diaphragm and hold at the bottom of your breath. 1, 2, 3, 4. Breathe in. Pelvic floor, belly, low back, ribs, chest. Collarbones lift and hold. 1, 2, 3, 4. Exhale, slowly release. Empty out the breath. Feel everything hug in, a little contraction, and hold. 1, 2, 3, 4. 3 more. Breathe in. Hold. 1, 2, 3, 4. Breathe out. Hold. 1, 2, 3, 4. 2 more. Breathe in. Fill. Feel each part of this breath, of the 3 parts. Then hold. 1, 2, 3, 4. Release. Actively exhaling. Fully emptying the breath and feel everything hug in, strengthening. Now hold. 1, 2, 3, 4. Last time. Go at your own pace. I want you to get that nice inhale and then feel like you're fully open, like a 360-degree expansion. Then hold that expansion. Then when you're ready, slowly exhale out of the nose and contract as much as you can here. Actually feel that hugging in. Feel the deep layer, your transverse abdominals engage here for this. Even your pelvic floor kind of lifts up a bit. Men, you have a pelvic floor too. And relax. Go back to normal breath. I like to sometimes use touch. So sometimes I will rub the top of my thighs. I will kind of give myself a little bit of a cue in between these breathing techniques. It feels good. Just encouraging this connection, mind, body connection. And then just bring that smile to your face. We're going to do one more round today. If you can stay with me, thank you. What I want to see in this round is this same thing. We're just layering on a little bit more. So in this round, we're going to do that inhale. We're going to do the hold. But for the exhale, I'm actually going to have you exhale, sigh as you release. So you can make a sound. And that is going to activate the core even more, working on respiratory diaphragm, working on a little bit of this core coordination as well. Let's begin. Close your mouth. Close your eyes if you're able to. Notice the body, the sensation. Notice the breath. Can you release any tension that you may have? Any resistance, any judgment, any criticizing of self? Can you bring that smile to your face and thank yourself for doing something good for your well-being? And let's begin. Inhale, fill from the pelvic floor, the belly, the low back. Keep inhaling into the heart, into the ribs. Keep inhaling. Collarbones lift slightly. Hold for 1, 2, 3, 4. Exhale out of your mouth. Hold. 1, 2, 3, 4. Try it again. Inhale, fill from the bottom, midsection, heart, collarbones. Hold. 1, 2, 3, 4. Exhale out of your mouth. Sigh and release. Let go of the breath and feel the hugging in. Go to the end of your breath and hold isometric contraction. 1, 2, 3, 4. Inhale, fill. Hold. 1, 2, 3, 4. Exhale. Hold. 1, 2, 3, 4. 5 more. Inhale, fill. You're doing great. Hold. 1, 2, 3, 4. Exhale, release. Hold at the bottom. 1, 2, 3, 4. 4 more. Inhale, fill. Pelvic floor, belly, low back, chest, heart, ribs. And then exhale, sigh and release. Go to the bottom. Hold there. I didn't do a very long hold on that last one, but hold here at the bottom. And we have 3 more. Inhale, fill. Expand, 3 parts. Hold at the top for 1, 2, 3, 4. Exhale, sigh, release. Go to the bottom, fully empty out your breath. Feel that hugging in. It feels good. Give your internal organs a little massage and hold at the bottom. 1, 2, 3, 4. You have 2 left. Inhale, fill. Expand. Stretch from the inside out. Hold equal, even pressure inside your body. This is intra-abdominal pressure. Keep holding. And then exhale, sigh and release. And then feel that hugging in, that lifting. Fully release the air and hold. We'll do 1 more. Inhale, fill. Hold at the top. 1, 2, 3, 4. Exhale, sigh and release. Hold at the bottom. 1, 2, 3, 4. Relax, soften completely. Don't try to control the breath. Just come back to a natural, easy breath. So as you saw with that breathing practice, the 3-part breath, we started a little easier in and out of the nose. Then we held on with our retention at the top and at the bottom of the breath. And then we kept retention, but we added that exhale, sigh, and release. So you determine which one felt the best for you. And the way I would include this into my day is if I was feeling any stress or anxiety, do 10 of these breaths. Just stop if you can, find a comfortable place to sit or lay down, and do 10 of these 3-part breaths and see over time how much stronger your respiratory diaphragm gets, how much more connected you get to the vagus nerve, and being able to tap into that parasympathetic nervous system state to calm yourself down. A side benefit is increased lung capacity. It's better muscle functioning. It can help you with your posture and your ADLs, your daily movements, daily activities. So it can help you with injury prevention. That's some of the reason I like breath work. Some of you know that I've had back pain for a very long time. I've had back surgeries, and breathing has really helped me with my own healing. So if you found this helpful, if you liked this, please comment below. Please like and subscribe to my videos, and reach out to me if you want to learn more about Speak Well coaching or my program, Breathe Well, Live Well. Thank you for being here. Have a wonderful day. Breathe well, live well, and speak well. Bye, everybody. Bye.